So, here we are talking about another variant of anxiety disorder that has its own signs and symptoms when they clinically present in the outpatient departments or even in the wards when you work on the patients. So, it is basically the obsessive compulsive disorders that we usually come across. So, it's another variant, and it's quite interesting to reflect upon the signs and symptoms in these particular individuals and how are you going to grade them according to their severity. Now, this is sometimes a borderline personality that you would usually expose when you get the history from a corroborative history from the relatives or the friends or from the person himself. He'd give you the clues towards his obsessive and his compulsive personality that he had been suffering from since his childhood. So it's basically a personality disorder sometimes, and sometimes if it is interfering the day-to-day life in a particular individual, it can be a pathological condition as well that needs the medical intervention along with the pharmacological therapies as well. So in this section, basically, we are focusing upon this interesting variant known as the OCD or the obsessive compulsive disorder. The etiology will be discussed in detail. How does it occur in these individuals? What are the basic factors, the causative factors for such a condition? Then the prevalence worldwide would be discussed. The assessment, how do you assess such patients? And then we'll discuss the treatment guidelines in these obsessive compulsive disorder patients. So basically, the diagnosis again is very important. It's recurrent obsessional thoughts are usually experienced by such individuals. The compulsive acts are noted. And for example, there's an invariably distressing feeling in these individuals, involuntary and often a repugnant act. So sometimes the patient would give you a history that he has an obsession for cleanliness and that he'd go to wash his hands again and again, even if they are clean. He'd wash them again and again. So this obsessive thought that he has, that his hands are not clean, and then his action, this compulsive act that he's going again and again, and sometimes you'd even find eczemas or rashes on the skin of such patients. So sometimes it can be a very detrimental disorder in a lot of individuals. The consideration of alternatives is again very important. The obsessional slowness. So sometimes he would have that thought again and again, and his actions would be rather slow than a normal individual. The compulsive acts or rituals would be found in such individual. The stereotyped behaviors would be observed, not inherently enjoyable. Pointless or ineffectual rituals would be there. There'll be repeated attempts to resist them as well. If resisted, the anxiety gets worse. So he had to perform that act, whether it is effective or whether it is not effective, regardless of that fact. He would have to do that to get rid of that anxiety that he has. So the diagnosis again is very important over here. They are concerned with cleaning all the time. Presentation of OCD varies in the individuals. Obsessional thoughts sometimes are to the fore. And for example, upsetting and violent sexual thoughts are sometimes a part of their obsession. And then sometimes they're quite compulsive. They are to fore, checking kitchen cupboards to ensure that labels on every jar and tin face in the same direction. So this obsessive compulsive disorder is usually seen in these individuals. They have to keep everything upright. Everything has to be in an order in their life. Prevalence of the OCD, it's basically a very rare condition. It affects 1 to 3% of the population. The individuals not present to services can have comorbid anxiety disorders as well. Onset is usually earlier in boys, and males are commonly affected by such a disorder. They're associated with physical tics as well, and the course of this OCD is sometimes quite chronic in such individuals. Talking about the etiology of these individuals, in part a genetic condition, increasing evidence of underlying brain abnormalities. The first degree relatives would give you a history with OCD, the higher rates of anakinastic obsessional personality. The OCD concordance rate is usually between monozygotic twins, that is usually 50% to 80%, and in the diazygotic twins, it's usually 25%. So the etiology usually consists of the serotonergic system abnormalities, role in the OCD, hypersensitivity of the postsynaptic serotonin receptors. Symptoms are usually common in the Gilles-Delay-Tourette syndrome. So it's basically one of the syndromes in which the OCD is quite common. 80% of the individuals with this Tourette syndrome have the obsessional symptoms as well. Now we can have the basal ganglia abnormalities as well, the role in the OCD and the Tourette syndrome, and then there are the brain circuit anomalies as well. There's an overactivity of the thalamocortical pathways as well. The assessment in such individuals is very important. Obsessional symptoms are not necessarily mean that they have an OCD. Obsessional symptoms in other psychiatric conditions are also commonly observed, for example, in schizophrenia and in the early dementia. The patient would usually give you the history of obsessional thoughts. The close relationships between obsessional remuneration or depression, and then the person would give you a history of pre-morbid anachronistic or obsessional traits as well. The management lines usually consist of serotonergic or antidepressant drugs. The SSRIs or the clomipyramine are sometimes the drugs of choice in these conditions. The dopamine receptor antagonists are usually considered. Now, neurosurgeries is one of the options that is to be considered in such individuals. The anterior capsulotomy and the subchordate tracheotomy is one of the neurosurgeries that is considered if this obsessional compulsive disorder is of an extreme type and the surgery cannot be prohibited in these individuals. The CBT, that includes the counseling sessions along with the pharmacotherapy as well. Deep brain stimulations, they include the under clinical trials. For rituals, it's usually the prevention and the graded exposure along with them. Now, for obsessional thoughts, usually what we do is basically we consider the cognitive behavioral therapy that includes the counseling of the patients, and along with that, we consider that we're going to start off with some of the antidepressant drugs. Along with that, we're going to control the compulsive disorder in that individual area as well. And for the obsessional thoughts, we're going to counsel the patients so that they don't get to experience those obsessional thoughts that commonly. The thought stopping technique is obviously the CBT that we were talking about. So in this section, basically, we focused on the fact that how this obsessive compulsive disorder can be controlled, what is the prevalence of this disorder, and what are the treatment guidelines. Obviously, the treatment guidelines include the counseling sessions as well as the drugs of choice that include the buspirone. So that is the end of this section. Thank you for watching sqadia.com.